How is an invasive breast cancer biopsy performed? Imagine a process that helps doctors unlock the secrets hidden inside a suspicious lump in your breast. That process is an invasive breast cancer biopsy, a key step in diagnosing whether a lump is cancerous. The procedure begins with careful planning. Usually, it is done under local anesthesia, meaning you stay awake but the area is numb to prevent pain. This way, you won't feel discomfort during the procedure, just some pressure or mild sensation. The doctor first uses imaging techniques like ultrasound, mammogram, or magnetic resonance imaging to locate the exact spot of concern. These images guide the doctor to precisely target the suspicious area. The most common methods are core needle biopsy and surgical or excisional biopsy. In a core needle biopsy, the doctor cleans the skin over the lump and injects numbing medicine. Using imaging guidance, a hollow needle is inserted through a tiny incision to remove small samples of tissue. Sometimes, a vacuum-assisted device is used, which can collect larger or multiple samples in one go. After the tissue is taken, a small metal clip is placed at the site to mark the area for future reference if needed. The incision is then closed with adhesive strips or a bandage. This process usually takes about 20 to 30 minutes. Most patients experience only a feeling of pressure rather than pain and can often go back to their normal activities the same day. In a surgical or excisional biopsy, a surgeon performs the procedure in an operating room. This method involves making a small incision to remove the entire lump or suspicious area. Sometimes, before surgery, a wire or radioactive seed is placed into the lesion under imaging guidance to help the surgeon find the exact spot. The tissue removed is often X-rayed to confirm it includes the targeted area. Sometimes, this biopsy serves as the only surgery needed to remove the cancerous tissue completely. Most patients do not need to stay overnight in the hospital. There are other types of biopsies, like fine needle aspiration, which uses thinner needles to collect cells. However, these are less common for definitive diagnosis because they provide less tissue detail. Once the tissue is collected, a pathologist examines it under a microscope. They look for cancer cells and analyze the tissue to determine the type and characteristics of the cancer. This information is essential for planning treatment. After the procedure, it is important to follow your doctor's care instructions to reduce the risk of bruising or infection. Any discomfort usually resolves quickly. In summary, an invasive breast cancer biopsy is a carefully guided process that uses imaging to target suspicious areas, local anesthesia to keep you comfortable, and marker placement to help with future procedures. It is a vital step in confirming a breast cancer diagnosis and guiding treatment options. Always remember to consult your healthcare provider for personalized advice and support throughout this process.